Hello and welcome to the Practical Pediatric Medical Information Channel. Wow, that's a mouthful. I am MZMD. I'm a board-certified pediatrician. I am licensed in several states in the United States. I would like to emphasize that this video and all other videos on this channel are meant to be informational only and are not meant to be a substitute for diagnosis and treatment by your child's doctor. I hope that you will join me on these coming videos, and do not forget to like, share, and subscribe. Remember, subscribing does not mean that you're paying anything, but that's a way of notifying you when a new video has been uploaded to this channel. So let's proceed to the next topic. Your child has a runny nose and you wonder, is it allergies? Or is it a cold? Or maybe it's a sinus infection. In fact, that runny nose can be caused by all of those things. Allergies or allergic rhinitis, colds or upper respiratory infections, or bacterial sinusitis may all give you runny noses, coughs, headache, sore throat, sinus pressure. All three may also cause you not to feel well, and also all three may give you what we call purulent rhinorrhea. Purulent rhinorrhea, or discolored mucus from the nose. It can be green or yellow, thick. All three can give you these symptoms. Since allergies, colds, and bacterial sinusitis may all give the same or very similar symptoms, how do we go about differentiating these? That is what this video is about. Let's first discuss allergies or allergic rhinitis. We all are familiar with the symptoms: sneezing, itchy eyes, runny nose. However, there may also be with allergic rhinitis coughing, sore throat, headache, sinus pressure, purulent rhinorrhea. The cough may come from a postnasal drip and is usually worse early in the morning or late at night. You can also have, as I mentioned, purulent rhinorrhea or discolored mucus from the nose if the mucus has been sitting there for a while. Typically, with an allergy or allergic rhinitis, you will not have a fever. And the cough usually is not prominent, but you can have sore throat and all of the other symptoms I mentioned. Now, the symptoms from allergic rhinitis are caused by a chemical which is released from some of your cells when the substance that causes the allergy symptoms comes into contact with your cells. This chemical is called histamine, and it leads to the runny nose, the sneezing, the itchy eyes. And that is why we treat allergies with an anti-histamine or antihistamine. As I mentioned, allergies do not cause a fever, and allergies also are not treatable with an antibiotic. Now let's speak about colds. Colds or upper respiratory infections, or also called rhinosinusitis, are viral infections Viruses typically will cause runny nose, cough, fever, sore throat, headache, sinus pressure, and purulent rhinorrhea. These respiratory symptoms usually last for about 7 to 10 days, and fevers may last 3 to 4 days. The cough with a cold is usually more prominent than you would see with allergies. Typically, the cough from allergies are usually early in the morning, late at night, and the coughing from a cold will be all day long. The cold may also cause sinus pressure as well as purulent rhinorrhea. Colds many times will cause fevers where allergies will not cause a fever. Since colds are caused by viruses, they are not treatable with an antibiotic. Colds typically will resolve by themselves in about 7 to 10 days after your immune system has eradicated the virus. Let's speak about bacterial sinusitis. Why do I say bacterial sinusitis? That is because there is also viral sinusitis. Colds are typically caused by viruses, and they do produce somewhat of a sinus infection or sinusitis. In fact, another name for a cold is a rhinosinusitis. Colds caused by viruses may give you all of the same symptoms as a bacterial sinusitis. They may give you headaches, sinus pressure, purulent rhinorrhea, and fever. How do we differentiate a viral sinusitis from a bacterial sinusitis? Bacterial sinusitis, as most bacterial infections, are secondary infections. They come after having mucus from an allergy sitting there for a while, or a viral infection which has been giving you symptoms for a while. What is a while? It's about 7 to 10 days. We know that viral infections cause symptoms, respiratory symptoms, for about 7 to 10 days. So typically, if an illness lasts more than 7 to 10 days, or if fevers last more than 3 to 4 days, that indicates that there is a possible bacterial infection, and therefore that is something that we can then treat with an antibiotic. So the definition of a bacterial sinusitis, which is treatable with an antibiotic, is you have to have symptoms for more than 7 to 10 days, or those symptoms have to be worsening after 5 to 6 days. The bacterial sinusitis may give you fever, cough, sore throat, pressure in the sinuses, or also purulent rhinorrhea. So all of those symptoms can come with a bacterial sinusitis and can also make you feel awful. So in summary, allergies, colds, and bacterial sinusitis can look and give you all the same symptoms or similar symptoms. How do we differentiate them? Allergies may come and go, and they typically do not give you fever. The cough usually is not prominent. Colds may give you a prominent cough, but not all of the time. Colds may also give you fevers, and colds typically will last 7 to 10 days. Usually are not treatable with antibiotics. Bacterial sinusitis will give you very similar symptoms as colds or allergies, but they are diagnosed after 7 to 10 days of symptoms, or symptoms worsening after 5 to 6 days. And that's pretty much how we differentiate those three things from each other. Hopefully this video has been helpful, and I encourage you to join me on the next video Don't forget to share, like, and subscribe. That is all for now. This is MZMD wishing you a healthy life.